Okay, you ready?
Yeah.
Okay, eyes on your target. Okay. Now you've done a backflip.
Why? Was I gripping hard or something?
He's had the worried eyes.
Yeah?
Yeah, I can see him.
I mean, you're going backwards, and you're right. It was, I thought, even though you said it,
Yes.
right? Because we went backwards, and it didn't go like that. All right, okay. I'm good now. All right.
Yeah, it's always a little bit more than what you anticipate.
Yeah.
Okay, you ready?
Yep.
Same thing, but just the other direction, still backwards.
Okay.
How was that?
It's good. Much
Looks
better
good.
than the first time.
Yeah, everything did look good.
Okay.
So I'm pitching you back because of your center of pressure. I'm just trying to get your brain to understand that since your center of pressure is so posterior, if you go posterior, then that's not normal, right? So you have to flex forward as a reflex response to wanting to go
Right.
posterior. So that's kind of how I'm fixing that. Now, a lot of this here that you are doing is all vestibular on that inner ear canal because you're not necessarily feeling the floor. It's not like something's moving, but you're like in a still floor. The floor is moving with you.
Right.
And I am giving you a target to look at, so there's a little bit of that too.
Yeah.
So how do you feel about doing this one again, eyes closed?
I think it'd be easier eyes closed.
We're gonna give it a shot.
Yeah.
Okay.
Yeah.
It'll be the same as the first one. That was clockwise. You ready?
Okay. Now, what do you want me to look at when I open my eyes? You?
The target.
Okay. This one or this one?
That upper one.
Upper one. Okay.
Okay, you ready? Good job. That was real good.